Thank you for joining Research Opportunities and Tracks within the health professions. My name is Charlie Scruggs, and I'm the Director of the Health Professions Advising Center at the University of California, Riverside. This presentation will spotlight various research opportunities across health professions programs. Today, I'm going to talk about how to research various programs to gain a better understanding of how some clinical degree programs are structured to allow students to incorporate learning across academic, clinical, and research experiences. This session is part of the UCR Spring 2020 Undergraduate Research Symposium, sponsored by Undergraduate Research and the Office of Student Engagement. The Undergraduate Research Symposium runs through May 29th, 2020, and this is a great way to explore the various types of research opportunities, see what your peers have done or are doing, and the ability to meet and see various faculty members, researchers, PIs who are doing cutting-edge research. This may also be a way for you to connect with those who you might want to be able to do research with as you continue or move through your undergraduate experience. I wanted to also share a little bit about the Health Professions Advising Center as we get started this morning. The Health Professions Advising Center's mission is to provide information, advising, and support to students and alumni who have interest in health professions programs. Again, thank you so much for joining us for this info session on researching opportunities and tracks within health professions programs. I wanted to start with talking a little bit about health professions programs and how they're set up. So most of us think when we go into a health professions program, medical school, dental school, pharmacy school, etc., you're going there to learn how to be a clinician, and that is true. But many of the clinical programs are focused so that students will learn from those practitioners, as well as learning how to incorporate the most latest research discoveries in those fields to help support them and their patients to provide the highest quality of patient care. So let's talk a little bit about that. So when you go into a health professions program, let's say you want to be an optometrist. You want to go into an OD program, not DO, which is osteopathic medicine, but OD, a doctor of optometry. So you'll start optometry school, and in that 4-year program, you'll be exposed to clinicians who are other optometrists, as well as researchers who are often PhDs. And collectively, those clinicians and those researchers work together to make sure that you're being trained accordingly and to address some of the top health issues that are being addressed in that field. You can apply the same example to other health professions: dentistry, pharmacy, audiology, physical therapy, nursing. There are researchers and clinicals in all different health fields, not just allopathic MD medicine. Many of these programs are associated with teaching hospitals and clinics. So you're also going to hear the term academic medical center throughout this presentation. Some of the most well-known teaching hospitals and clinics are here in California: UCLA, UCSF, Stanford, and then throughout the country: Johns Hopkins, Mayo Clinic, Emory, Case Western Reserve, and so forth. Many know about the MD PhD program. That's probably the most well-known when we're thinking about clinical research and healthcare. So we call these programs MD PhD programs, medical scientist training programs. These are fairly lengthy programs, oftentimes 7 years, that combine 4 years of medical school as well as a PhD program. Many PhD programs are 5 years, 6 years, maybe even 7 years or longer. But these very structured programs are typically 7 years where students will go through medical school as well as a graduate program to earn an MD PhD. And in those programs, they'll take the requirements for medical school, the didactic coursework, which is your basic sciences, if you will, in medical school, as well as their clinical rotations, rotating through hospitals and clinics, as well as doing research to address a problem or problems, and then presenting their research through a dissertation, which is a fairly lengthy presentation or maybe even a publication over their findings. These programs are funded by the National Institutes of Health, and I've provided the link there that you're able to go onto the NIH and explore what MD, PhD programs are, as well as where they exist. So not every medical school has an MD, PhD program. Again, these are medical scientist training programs. They are specifically designed to provide students with that clinical component as well as that research component, and typically done at an academic university and medical center. So again, some of the examples that I shared earlier. Go on to the NIH website and you'll be able to see their structure and more information about those specific programs. Additionally, there are research-focused programs in MD programs, allopathic programs. These are found such as UCI, UC San Diego, UCSF, University of Pittsburgh, Case Western Reserve, Mayo. And some of these medical schools that I have listed have MD programs, of course, and MD PhD programs, but some of them within their MD programs, they actually intertwine research. So you have to look at each program to kind of see how they're tailored to their specific mission and research interest. But one that I'll talk about is Case Western Reserve. So Case Western Reserve is a school in Ohio, it's in Cleveland, Ohio, that has a couple of different programs. And I use this as an example because it's a great way, it can be a little bit overwhelming when you first click onto their website, but it's a great way to lay out this type of example. So they have a 4-year MD program, which is your traditional medical school curriculum. They also have a 5-year MD program. That 5-year MD program is really research focused. So it's not the MD PhD program that they also have that's very extended to possibly to 7 years or so. But it's a 5-year program that puts the clinician first, and it also teaches them and trains them in research, and so that they're able to conduct research as a practitioner. But that primary role of that 5-year MD graduate is going to be a provider. They're going to have that clinical responsibility as a primary role of their job. Where someone who is an MD, PhD, they're really more of a scientist first and then a physician. So that MD allows them to get access to patients, to be able to work in a healthcare setting, to do all the very basic things that they need to know how to do as a physician, but to have that very specialized research training on top of that. So an MD, PhD is more of a scientist first, physician second. So I hope this example gives you an idea of what a 4-year degree looks like, maybe what a 5-year or a very research-heavy MD degree looks like, and then what an MD, PhD, which is sort of the ultimate terminal degree for somebody who's interested in healthcare and being a research trained scientist. Many people don't know, though, that other clinical areas, such as dentistry, for example, also provides research opportunities. So Ohio State University, again, located in Ohio, has a 7-year funded DDS PhD degree that allows students to explore that basic dentistry piece. And what I will say is, if you're looking at DDS and DMD, there is no difference. So think of like a BA, BS. DDS stands for Doctor of Dental Surgery. A DMD is a Doctor of Medical Dentistry, and they're very interchangeable. It just really it's really based upon what the school, the institution decides to offer. But for this DDS PhD degree, which is very unique, it allows students to become that clinician as well as that researcher. And you'll see here, doing and conducting translational research in the fields of microbiology, genomics, molecular biology, biochemistry, immunology, epidemiology, and cell biology. So Ohio State is just an example of programs across the country where dental schools will offer not just the traditional degree, but also a research degree. Looking in the field of optometry, UC Berkeley offers the OD as well as other optometry schools, and that is a doctor of optometry. So again, the doctor of um, osteopathic medicine is the DO, but the doctorate of optometry is the OD, which is the general clinical degree for being an optometrist. So Berkeley, in addition to offering the OD, they also offer a PhD in vision science. And this is a 7-year program that combines that basic traditional optometry coursework with rotations, with seeing patients, with learning how to be an optometrist, as well as research. So looking at some of the findings that involve optometry, eye research, eye issues, and being able to explore those and maybe focus on an area. Additionally, veterinary medicine. So the DVM stands for the Doctorate of Veterinary Medicine, and this is the general clinical degree offered by vet programs across the country. Tufts University, which is located in Boston, is a veterinary school that also offers not just the DVM, but also a master's in science in a few different areas, as well as a PhD. And so as you're looking at some of the master's programs and the PhD, and sort of scratching your head with these, thinking, well, I don't know if I want to go into the traditional clinical degree or I want to go into a master's or a PhD degree. And that's part of figuring this out, hopefully as an undergraduate, is while you're out there shadowing, maybe volunteering, seeing the practitioner side along with the patient, also having the ability to engage in research, to explore challenges, problems, and going through those, going through that processes to really figure out, do I want to be in front of patients and interacting and solving problems with them daily, diagnosing, treating, or do I want to be on the other side where I might be working in a laboratory, or I might be working with other PhDs or physician scientists or researchers at different angles, trying to navigate various issues. I'm thinking of COVID-19 right now. So think of all the PhDs and the researchers that are trying to come up with a treatment and a vaccine. So they may not necessarily be in the hospitals on the front line of being at the hospital in front of a patient or the emergency room, but they may be going to a lab or a facility where they are working to try to find a vaccine or a treatment in the laboratory setting, and then working with researchers and clinicians to be able to test that on patients. So there is a little bit of a difference, and utilizing this time, getting out, talking to PIs, talking to physicians or other clinicians is really going to help you figure out how you want to move down the road and making the decision for what's best for you. In addition to dentistry and optometry and veterinary medicine, let's talk a little bit about pharmacy. You get a lot of questions in HPAC between what's the difference between being a pharmacist and being a pharmacologist? And that's a great question. A pharmacist, like the other examples that I gave, is the primary clinician or the provider, in this case, that's going to dispense medication or some type of drug therapy. They are going to work with the physician or the nurse practitioner or the PA or the podiatrist or the dentist or the vet, whoever's prescribing that medication, to understand what that medication is and what it's used for and the dosing and that type of thing. And for the patient, they are going to answer questions regarding the medication. They're going to educate the patient. They're going to talk about dosing. They are going to provide any type of information that needs to be conveyed to the patient or the provider of the patient to make sure that the drug is taken properly. So a PharmD is that very hands-on, working in a retail setting or a hospital or a clinic where they are dispensing medication. A pharmacologist is a PhD. And a pharmacologist is somebody who is working in a research setting. They're studying drug development and therapy. They are trying to come up with tests, with drugs to solve a variety of different issues, whether it be cancer, whether it be HIV, whether it be heart disease, many, many, many types of different issues they're trying to solve. With the clinical degrees and with the research degrees, not only is their title different and their jobs are different, but oftentimes the length of how long it takes for them to get through school is different. So for dentistry, optometry, veterinary medicine, pharmacy, those are all 4-year degrees. If you're pursuing a PhD in biomedical sciences, or let's say in pharmacology, that's typically a 7-year degree. Could be a little bit shorter, could be a little bit longer, but generally speaking, around 7 years. For the clinical degrees, the dentistry, the optometry, the veterinary medicine, the pharmacy, you have to pay tuition to attend those programs, generally speaking. Where a lot of your PhD programs, those are funded. So they're funded either maybe through a grant or through the academic institution. And the student usually receives tuition and maybe a stipend for the research and the academic portion of their coursework. Another area that I want to talk about is clinical lab sciences. This is either a bachelor's degree or a master's degree. I have it listed as a master's degree here because we don't offer a bachelor's degree in clinical lab sciences at UCR. So if you are a science or non-science major, you're out doing maybe bench research, and you are thinking, I would like to work in a lab. I don't know that I necessarily want to maybe doing long-term or longitudinal research. Maybe you do, but maybe you don't. But for this, let's say that you don't, and you are just interested in working in a laboratory setting, maybe at a hospital, in a lab, or maybe working at a clinic or at a private lab company. You could go on and get a master's of science in clinical lab sciences. And this is going to provide you the education and training to be able to do testing and analysis of various specimens and tissue samples that come into the lab. So again, a wide variety of ways that you might be able to explore the clinical and the research various programs that exist based on things that you think you might be interested in. So where do clinical researchers work? What happens once they leave their academic setting? So many of them work at colleges and universities, such as at UCR or for the University of California system. Some work at academic medical centers. And so as I mentioned earlier, academic medical centers are typically hospitals that are affiliated with colleges and schools of medicine, or colleges and schools of allied health, nursing, and maybe other health professions programs. And oftentimes they're located right next door on the same campus, and students run from class over to the medical center, and physicians run from the medical center over to class to teach. So they have a very tight-knit relationship. We see this at UC Irvine, we see this at UCLA, we see this at UC San Diego, we see this at UCSF, we see this at UC Davis. Additionally, we have very specialized institutions such as the City of Hope, which is located in LA, St. Jude's Children's Research Hospital, which is in Memphis, Tennessee, and MD Anderson Cancer Center, which is located in Houston. So these are very specialized types of clinical research areas where they are doing primarily research, they're doing advanced research, and they are usually affiliated with the City of Hope. Does have a clinical enterprise there. Folks are going there for cancer research. St. Jude's Children's Research Hospital is primarily a children's cancer hospital where they're doing very cutting edge cancer research for children, clinical trials in all of these areas. So Usually in these areas that I have listed, City of Hope, St. Jude's, and MD Anderson, these are clinical trials. They're really on the cutting edge, trying to cure an issue or solve a problem. Additionally, there's government agencies, so the National Institute of Health that's people are seeing on their TV throughout the day right now with the NIH focusing on COVID-19. There's the Food and Drug Administration, which oversees our food as well as drug development, and the Centers for Disease Control and Prevention as well. So these are some government agencies where many of the researchers work that may be clinicians, but primarily have some type of PhD or research expertise. There are private labs, Quest Diagnostics, LabCorp, where they work with hospitals and clinics to do testing, again, of specimens. And then there are pharmaceutical and drug therapy companies. So there's a variety of places that allow you to do research or clinical research. And I encourage students when we're talking in the office about next steps, I will talk about these areas and then also encourage them to go on to the websites and look to see what these institutions or agencies do, but also look in the job areas, look at the job postings, look to see what the job posting entails, what they're looking for in terms of education. And so you're getting a more informed idea of how you want to move forward, whether it's graduating and then going into the workforce, and then figuring out if you need to enhance your education and what that might look like, or if it's maybe doing an internship or some type of co-op short-term, and then applying to a master's or a PhD program, or even maybe optometry, dental, pharmacy, those types of programs that we've been discussing. As a UCR student, you have your fingertips at faculty and researchers that are doing cutting edge research. And so as a UCR undergraduate student, this is the time that you should be taking advantage of those opportunities. In addition to UCR, throughout the University of California system, right next door to UCR is Loma Linda University. And we have had UCR and the Health Professions Advising Center, specifically in undergraduate research, have been working with Loma Linda in their Department of Anesthesia department to promote some of the undergraduate research opportunities they have to UCR students. So Loma Linda doesn't have an undergraduate campus, and they reached out to us a couple of years ago recruiting undergraduates who might want to do research over in their medical center, specifically in the Department of Anesthesia. So I've posted the contact information for Audrey Romero, who's the research manager there, and you can reach out to Audrey if you do have interest in learning more about what type of internship or volunteer opportunities that might be in the Department of Anesthesia at Loma Linda. In addition to that, there are summer undergraduate research fellowships. We also call those SURF. And those are for undergraduate students throughout the country. You can go on to aamc.org. That stands for the Association of American Medical Colleges, and they maintain a directory of SURF programs. Generally speaking, they are pretty competitive. And so you would need to start looking in the fall or very early winter for the upcoming summer. So probably this fall, maybe even January at the latest, looking for opportunities in the summer of 2021. In addition to SURF, there's something called the Summer Health Professions Education Program. This isn't so much research focused as it is clinically focused. This program is really designed for first and second year students, or after the summer of your freshman year, or after the summer of your sophomore year, to be exposed to different health professions programs. They're clinically focused, but they also do touch on research opportunities. If you're somebody who is looking for a summer opportunity, you might look at the Summer Health Professions Education Program. It's shpep.org. And it's a one-time opportunity. So potentially you could do that for a summer and then come back to school and join undergraduate research or continue with research if you've already started, as a way to sort of mix and match or complement what the clinical piece would look like, as well as the undergraduate research piece. And then there's the National Science Foundation, nsf.gov, which is a way to get additional information. I'm also providing resources for most of the major health professions programs. Allopathic medicine is MD schools, osteopathic medicine are DO schools, followed by the other health professions that are fairly common. So this is a way to go in and look at a directory of all the schools in the US. There's no spam. You don't have to sign up for a mailing list. They're not going to charge you a fee. This is just a great way to go right to the source. And you can start clicking through schools just to get an idea if their mission is very general, if their mission is more community related, if there is a research focus at their school. And again, this is for all health professions programs. Even in the fields of physical and occupational therapy, even in public health, even in nursing, there are research programs. So as you go in and you look, you might be thinking, oh, for public health, I know that there's a master's in public health. Well, in addition to that master's in public health, that MPH, there's also Ph.D. degrees that are offered, and the same in nursing. So we know that there's the RN, there's the BSN, there's the MSN, there's a doctorate of nursing practice, which is a clinical degree, but there's also a research degree in nursing, which is a PhD. So there's a lot of different opportunities to combine clinical experiences and research together. So again, take a look at these national resources that we have for you. They are the actual resource. They are not, there's nothing that you have to sign up for. There's nothing that you have to pay for. These are all going right directly to the source. So if you do have questions about things that you have read through on the slides or things that I have shared, feel free to reach out to the Health Professions Advising Center. We're available at hpac.ucr.edu. So if you want to email us, you can also check online our website. We have a lot of different information available there. You can call our front desk to set up an appointment. Currently, we're using a remote number due to being out due to COVID-19. So that number is 951-888-1290. And then once we return to campus, we'll be at our normal number, 951-827-6233. In addition to email and our website and calling us, we do have a variety of social media accounts. So you can check us out on Twitter, on Instagram, on Facebook. We also have a YouTube channel. So definitely check out the information that we have for you. If you have additional questions, feel free to contact the Health Professions Advising Center. Thanks so much for taking advantage of this workshop. I hope it was helpful, and we hope to hear from you soon.